All right, so this is Penny. So I talk a lot about SI joint dysfunction and sacral torsion and sacral shear. So Penny, when she came to me, she had this for like 6 months, right?
Yes.
6 months. And she had been to some people, and they diagnosed her with like an IT band issue, IT band issue, but it actually wasn't an IT band issue. What it was is that SI joint dysfunction that was referring pain down into the IT band area. So that is pretty much gone, right?
Yes.
Yeah, so that's gone. I've been treating her about 3 weeks, and that's gone. But what she also had was these sneaky things called sacral torsion. So her sacrum literally rotated like this. So she had what's called a left on left sacral torsion. Now, I want to show you what that looks like. So turn and face that way for me. So where does it hurt? So she was doing great, and then I wondered that this could happen until it's stable, but she threw her kind of self out of alignment, and then show me where it hurts today. Right, so a lot of times with people with sacral torsions, they'll say, so this is the sacrum right here, they'll kind of point in and around here, and people will say, oh, well, it's a piriformis spasm or something like that. And yeah, maybe the piriformis is spasm, but it's spasm because she rotated, and that's why it's spasm, because the piriformis comes up like this, okay? And the reason why I know that is this, so go ahead and lay on your belly for me. So first I'm gonna check her SI joints to make sure that they're okay. So go ahead and put your hands next to your shoulders again, do a push-up. And on a prone press-up test, I don't see that any of my thumbs are dropping down, so that means that her SI joints are good, and she doesn't have SI joint pain. What she does have is pain right in here, right?
Yes.
Right in here. And oftentimes they'll take their hand and they'll kind of go like this. They'll kind of go like that and say it hurts in here. That's kind of a telltale sign of a torsion. But so what I'm going to do is relax your butt and then press up like a cobra. So as she comes up, keep going. Sometimes you have to come up all the way. So about halfway through that range, I did not feel anything happening to my thumbs. But as she came up even farther in the range, I saw this happen to my thumbs like that. My left side dipped. So go down there. So what happened was this. So as she came up, this went like, my thumbs went like it was fine here, they were equal, and then as she came up even farther through here, it was like that. One of my thumbs dropped down, which showed me she had her sacrum was torsion to the left. So what I'm gonna do is I'm gonna push here and re-rotate it, okay? So like this, I'm pressing on the right inferior lateral angle of the sacrum. I'm gonna re-rotate her and see if we can kind of calm this area down. Now, one of the exercises I'm giving her is a rubber band exercise to strengthen the right piriformis only to balance this out. So she's not rotated. So I always warn my patients. The last time she came in, she said, I feel great. It was like week 2 of us, right? She said, I feel great. And I told her, I said, I'm normally a positive person, but when somebody comes in and they have an SI joint issue or sacral torsion or sacral shear, I'm always kind of a Debbie Downer because I don't want people to get upset if this happens, which it typically does. It takes about 5 weeks. Go ahead and press up like a cobra. So now, up, 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 up. So now it's pretty stable. Do you still feel that in there, other than where I was pushing?
No, no.
No? Better? Go ahead and stand up for me. Stand up for me, Penny. Careful. Yeah. And now, if you still feel that in there, walk for me, please.
No.
No? Better? Yeah. So we're strengthening the right piriformis, and by strengthening that, we're going to create the tailbone to stay like that, in alignment like that, strengthen this muscle that attaches here and hold it down like this, and it usually takes about 5 weeks. And then, my goal for my patients is so that they know what happens. So her and I talked about, so if this ever happens in the future, she originally lives in Pennsylvania, she won't need me, she'll just be able to do these exercises, it should be good.